So, what is cyclooxygenase? In response to things like an injury or infection, the body triggers an inflammatory response to heal itself. Along with others, COX enzymes are involved in this inflammatory response. Cyclooxygenase is an enzyme that converts arachidonic acid, which is an essential fatty acid that causes inflammation in muscle tissue, into prostaglandins. Prostaglandins are chemicals that advance pain, fever, and inflammation, and some have a big role in blood clotting as well as defending the intestines and stomach against harmful acid. There are two types of COX enzymes, COX-1 and COX-2. They both make prostaglandins, but only COX-1 produces prostaglandins that have the previously mentioned ability of protecting the stomach and intestines. COX-2 is influenced by pro-inflammatory cytokines, which have a role in nonspecific and specific immune functions, such as inflammation and tissue repair, and is abundant in parts of the body that can be inflamed but not in the stomach. What is a COX-2 inhibitor? COX inhibitors, such as COX-2 inhibitor, are a subfield of NSAIDs, meaning nonsteroidal anti-inflammatory drugs, which decrease the creation of prostaglandins by blocking the COX enzymes. COX-2 inhibitors specifically block just the COX-2 enzyme, which makes it unique from other NSAIDs. And since prostaglandins are reduced, so is the inflammation, pain, and fever that they cause. Because COX-2 enzymes do not play a role in producing prostaglandins that protect the stomach and intestines, COX-2 inhibitors don't reduce those types of prostaglandins, meaning the risk of ulcers and bleeding in the stomach is not increased.
COX-2 inhibitors are used for reducing inflammation, pain, and fever, such as from sports injuries and menstrual cramps, such as dysmenorrhea. They are extremely popular for helping with osteoarthritis and rheumatoid arthritis. In fact, they are one of the most prescribed drugs for them. COX-2 inhibitors are also used for ankylosing spondylitis in addition to different types of back pain.
There are numerous side effects due to COX inhibitors. Some include headaches,
Nausea,
diarrhea,
insomnia,
fever,
hearing loss,
and light sensitivity. With the use of COX inhibitors, specifically those targeting the COX-1 enzyme, the number of prostaglandins that protect the stomach and promote blood clotting decrease, creating ulcers in the stomach and intestines, as well as a heightened risk or possibility of bleeding. Additionally, some COX-2 inhibitors, such as Vioxx, also known as the drug name of rofecoxib, can increase the risk of cardiovascular injury, such as a heart attack and stroke, by as much as 24%. Because these inhibitors help with the, quote, stickiness of blood platelets, researchers believe that the stickiness could create a blockage in blood vessels of or near the heart, creating cardiac problems. For these extreme regions, Vioxx has been taken off the market since 2004. There's one to very few COX-2 inhibitors allowed in the U.S., such as celecoxib, which doesn't completely block the COX-2 enzyme.